We have a patient with posterior interosseous nerve entrapment syndrome after scuba diving. Scuba diving is using I am pointing here to the site of entrapment doing sonopalpation. So this is the site of entrapment in the radial tile inside the supinator between the two superficial head and deep head. We can see this segment, and when I am pressing over it, it causes a shooting pain to the patient. He is a physician and he's practicing scuba diving. He was in Egypt in Sharm El-Sheikh. He is using the oxygen cylinder and lot of pronation and supination movements that stressed his posterior interosseous. He returned with severe shooting pain and weakness in the extensor of the fingers and the thumb. Now we'll complete the examination and we'll change it in a transverse scan. This is how it looks in the longitudinal scan. And I'm pointing to the site of marking, and I'm using xylocaine gel as a medium for the ultrasound and to anesthetize the area. This is a transverse axis scan. We can see the segment which is swollen, and this is a brachioradialis, superficial head of supinator, deep head of supinator, and this is the radius. And now I'm starting my procedure. This is my needle tip piercing the brachioradialis, then the superficial head of the supinator. My aim is to hydrodissect the superficial head from deep head, so to relieve the posterior interosseous nerve. Now my medication, which is 3 cc dextrose 5%, 3 cc dextrose 5%, and plus 30 milligram triamcinolon, dissecting the superficial head from the deep head and the posterior interosseous lying in it, so it will be relieved. So now you can see the supinator superficial head is distended, and you can see that the dextrose is separating the superficial head from the posterior interosseous and the deep head. This will relieve the compression of the over the posterior interosseous. And after I finish in the middle of the tunnel, I started to inject at the edge of the supinator. Here you can see my needle, and I'm completing the procedure, finishing it. So I have hydrodissected the posterior interosseous in the tunnel itself inside the supinator and at the distal edge of the supinator muscle, finishing the procedures. And the patient has a follow-up after finishing the procedure with complete relief in 1 week.